Okay, so we are live right now with Sahar.
Sahar.
So, first question is, who are you and where are you from?
In case there are any other Danet listening, I'll introduce myself. So Yat She Sahar Kajan Oreganisha, not Kajan the Enchlant, Do Persian Bushes Chin, but Amin that should shade Do Persian Dashanala, but Adanes Dun Enchlant. My name is Sahar Kajanori. I am Persian and Navajo from Anath, Utah. That's in the Four Corners region. And I am a television producer and currently working in Montezuma Creek, Utah for a program called the Navajo program under the Utah Navajo Health Services System. So that's a little bit about me, and actually I guess we can add to that title a bit of a volunteer since the end of February. So we've been pretty busy getting our community, trying to get them geared up and convince them to stay home.
And so, what is the community that you're working with right now? What's the name of it?
So in the southeast corner of Utah, that's home of the Utah Navajos. And our program, my particular program, also covers the mute. You got to
Oh yeah, there was a little bit of a distortion. So try again. Where the southeast part of Utah?
Yes, the southeast corner of Utah. So we are the Utah Navajos, and also we do cover some of the White Mesa Ute Mountain Ute tribe.
Okay, how big is the Navajo Nation? Like the size and population?
Gotcha. So the size of the Navajo Nation is roughly the size of West Virginia. You can picture that. And imagine West Virginia having only 9 grocery stores, a place where you can get fresh produce, and less than 200 officers. So you can imagine that's pretty. It's a pretty big state, big nation in terms of geography.
And I had 200 officers for that whole place.
Less than 200 officers.
And there's only 9 grocery stores.
Yes.
That's crazy.
Our population sits roughly just around 350,000.
Wow.
People.
Okay, so you sent me a link yesterday, and the numbers might be outdated, but the link yesterday had said there are currently 247 people infected, and there are 7 deaths right now. Is that correct?
Yes. So there's 321 cases as of right now, and 7 deaths.
Wow. So when did this start, and how did it start? And this is like we're not talking about Utah. We're not talking about anywhere else. We're just talking within the area that you're working in. This just the Navajo Nation, not talking about the white population, talking about the native population. Correct?
Okay. Yes. So what's interesting, the first cases, let me give you the exact date, and I don't want to give you misinformation, and so there was an evangelical Bible study or an evangelical, maybe like a revival of some sort. And at this event, the preacher was sick and coughing and hugging and shaking people's hands. And even though this was after the jazz player Gobert had announced that he was COVID positive, even after there were notifications from all over the U.S. that the COVID-19 virus was present, this group chose to continue with their social gathering, and that was the hot spot or the epicenter of the virus. So I find that interesting, and since then it's branched out. So all of the people who were attending, and also their family members, community members, saw this huge spike in cases coming out of the Chichen Bato town, and they would go to the Kayenta hospital, and that's where we see those cases coming from.
Wow. So this came from a Bible study, a Christian Anglican gathering, evangelical
Yes.
gathering.
Yeah.
And the priest was sick, but he decided to just go and do this anyways.
Yes.
So when did you realize it was a problem?
The minute we had case number one, and by the way, I want to say we do have Pete on the line, Mr. Pete Sands, coming in from, and also Montezuma Creek, Utah. Pete, are you able to tune in? Let's see.
Just Pete can't turn his camera on. He's got to be on just audio, otherwise it's going to mess up the program.
Okay.
But are you there, Pete?
Yeah.
Okay.
Cool.
All right. So we were kind of going through a bit of the questions, and when we just got through when it started and how it started. But when did you realize, Pete, that this was a problem?
I think when we saw the initial positive cases, because I knew from the beginning that once it came to the Navajo Nation, would have a tremendous impact on it, a negative impact, because of the high health risks that are on most Indian reservations. I can only speak for Navajo reservation, but it has a high, like diabetes is high, heart risk is high. There's a lot of respiratory problems. There's a lot of health problems on the Navajo res, and I knew that once it hit here, it would just, it'd be devastating. So once the first cases came through, I knew it would be all bad from there on.
How fast did it spread? Like, how many days are we talking about?
Dude, that thing spread fast. I mean, Sahar knows as well. I mean, the numbers like doubled within a couple of days. Now it's almost at 300.
When did this?
It's almost. Yeah, I mean, I don't know, man. I mean, we knew it was going to come. It's just a matter of time. We just tried our best to prepare for it, but there's really no preparing for anything like this, because there really hasn't been anything like this.
Does it scare you how fast it spreads? Because there's that initial church meeting to like 300 within what is it, 10 days, 8 days?
I think Sahar probably talked about how fast it spreads. I mean, it's something that it comes to life when it gets inside of you. It's not something that's alive on its own, and it just multiplies quick inside your body. But it's just, you think about it and you tell people that it's out there, and it really, this is, a lot of people call it the great equalizer, because it doesn't know no boundaries. It doesn't care if you're rich, it doesn't care if you're poor, it doesn't care who you are. It'll take you down.
What is the nation doing right now to try to control the spread?
Go ahead, Star.
Okay. So I think we'll both touch on some of the things that our Navajo Nation President Jonathan Nez is doing to encourage our Navajo Nation residents to flatten the curve. So he's really trying to ramp up measures to make sure that people are staying home to avoid transmitting the disease from one person to the next. But they have enacted curfews. So 8 p.m. to 5 a.m. Mandatory house stay. Also now, as of we just had the town hall meeting today online. As of tomorrow, they will start citing you. So if you are cited for breaking this curfew law, you will be charged with a criminal nuisance charge, and Chief Francisco stated that would also entail a 30-day mandatory incarceration or a $1,000 fine. And they're pretty serious about it. And at the same time, he's also about officers being out in the public, being potentially exposed. So he's not happy about all the people that are driving around, that are not essential employees, or making, emergency supply runs. So those are a couple of the things that Jonathan Nez is doing. Pete?
I think Sahar touched on everything because really the real problem is getting people to stay home. And reaching the elderly population is also another challenge because a lot of the elderly don't really understand what the virus is, and to translate that into our language is it's pertinent how we have to get that out there, that this is really bad, and it's really bad on elderly people. And but this is something that's you really can't put into words about how in our language you can't really put into words without being like too direct. I don't know if you understand what I'm saying. It's like if we say in our language how bad it really is, it just means death.
Yeah.
We don't want to go straight to death. We're trying to say like it's bad for you. It could lead to something worse. That's what we're trying to say, but our language really doesn't have words for that type of breakdown. But that's I agree with what President Nez is doing, because we have to get people to stay home. We have to stop this, and they're really, I mean, it's come to this. It has to, for people to listen. And you drive around the reservation. We deliver food, we deliver firewood, and you still see people driving around and hanging out at stores, and they're not taking it seriously, man. And this is these young people who are just hanging around at the stores. They don't understand if they catch it and they go back to grandma, and grandma catches it. It's not good for grandma, man. But this is we're all trying to.
So both of you work on the front lines in the COVID crisis. What do you normally do while you're like you're delivering food? What else are you doing?
We deliver food, household supplies. We deliver firewood. We're gonna start delivering drinking water here soon, and we're also we have a couple of programs we work together with Utah Navajo Health System, Navajo program. We are Navajo. We also are coordinating with the Rural Utah project out of we're all trying to collaborate with each other to try to reach as many people as we can, and really, really try to help people. And we're also trying to limit the amount of workers we have, because we also have that rule. We can't have that as many people in the same room packing stuff. We can't have too many of that. So we adhere by the rule.
Oh, his audio cut out a bit.
Oh, so just FYI, internet's kind of spotty, so
okay.
Is
he still connected? Can you still see him connected or no?
No, his camera's off for a second, so we'll give him a second while that glitches.
Okay. And yourself, what are you doing right now for this as a frontline worker?
Same. So we go out on deliveries together, and we're packing boxes together, splitting logs, loading the truck full of wood. So let me just give you an idea of what the landscape looks like. So it's a rural lifestyle. So most homes are heated by wood stoves, and for a lot of our elders, they need wood to make a fire to warm their houses. But if they don't have anybody who is readily available to go, and sometimes, we're talking about, let's say, 80-year-old seniors that are like physically able to do that. So a lot of times they rely on, the chapter house, or they rely on relatives. But at this time, some people are serious about COVID and some people aren't. But they're not getting family members coming to their houses delivering wood, and we recognize that that's a big issue. So Pete has created a firewood program, which he's self-funding.
Wow.
So yes, he's been like an angel for our community. But we travel to places to collect wood, and so we're out filling up the truck bed, and then driving 1-2 hours back home, and then going to these elder houses in the community and making that drop off, and then going back to refill some more. So at the same time, we might be doing food drop-offs as well. And something really important that I want to mention, when we do have volunteers, or just, Peter, I, or whoever's involved at the time, we want to make sure that safety is key. And to do that, we make sure that we're always wearing gloves. We're always wearing face masks, and it's not just.
Are those homemade face masks? Or are they legit?
So we are utilizing both. So we're using face masks, the surgical masks underneath these, and then we leave them on the dashboard in the sunlight to kill any bugs.
Yeah.
Not bugs.
The virus.
Virus. And other people are making them. So I want to make a note about these homemade masks. Is that I notice a lot of people are selling them online, and I want to make sure, just to remind everybody, that when you're making these masks, that we're doing two-ply, so two sides of the fabric, and inside the fabric, I know it sounds silly, but lining them with coffee filters, because the nanoparticles that are coming out when people are coughing or sneezing, or even talking like a daily dialogue, this will, a combination of these plus this, if this is stitched inside it, this is much more effective than not wearing a mask, obviously. But to make sure that when people are making these, that they're also utilizing 100% cotton materials to create these masks.
Wow.
So
how scared are you of catching it and bringing it back?
I'm nervous, because we were talking about people who are susceptible to falling ill from COVID-19, which of course are elders, but also those who are immunocompromised. Anybody who's diabetic, people who have other immunodeficiencies. But I'm particularly concerned because just in January I had pneumonia, so I feel like respiratory issues are like concerning to me. But I do follow proper precautions. I mean, washing hands constantly, and I think people feel like, yeah, I wash my hands good enough. But if you really, if you ever turn on a timer and leave a timer on your phone while you're washing your hands, and actually give yourself time to roll up your sleeves and to get a good lather, up the arms and places that, we touch things and daily, even opening a door like this, or resting your arms down on a desk or a counter, or these types of places. Making sure that we're washing and really getting a good, thorough, cleaning every time we're washing our hands, or making sure that we're wearing gloves, covering our face, and practicing social distancing. Give people 6 feet away to make sure that you are keeping yourself safe and keeping them safe, because it's not just I'm not only concerned about me catching a virus, but if something, heaven forbid, happened, I wouldn't want to be responsible for getting anybody else sick. So I'm always concerned and making sure that I follow all the safety precautions, and as is Pete. So that's also something that we're always trying to encourage people who volunteer with us. Also, if we make that, actually not just encourage, we make it mandatory.
So Pete was saying this is crazy, because I know the CDC are changing their stances on masks. Last week they're saying don't, and this week they're saying please do make masks. Everyone should be wearing a mask, sick or not.
Yeah.
Do you feel like the coffee filters are something that will actually work, or do you feel like it's kind of like a placebo?
CDC was encouraging people not to wear the surgical masks while they're out and about, for this reason. And it's the same reason I think hoarders have completely missed, which was, please save the surgical masks for medical staff. Allow these supplies to be readily available to those who are serving the general public. So when it comes to these homemade masks, if you're wearing a a two-ply, a double layer, 100% cotton fabric, in addition to, other materials that are breathable, but wouldn't allow, like, those. It's kind of like a four-ply of barrier between your air supply and the outside air, especially if you're like in an indoor or a closed environment. These are things that are going to be far more effective than not wearing them. So I do encourage people to wear, the reusable masks, but leave a lot of the supplies for people who need those. Additionally, hoarders, purchasing entire pallets of Lysol wipes and Clorox or bleach and other disinfectants, leaving people who need those types of materials, people who need those types of products are no longer able to purchase those because our shelves are empty.
It's crazy.
I think more or less it's kind of along the same lines of why that they would suggest. CDC would say last week, don't wear it, and this week they say wear it, because I think people are catching on. Just if you are wearing the homemade masks, like, make sure that these are all things that you are paying attention to, like what it's made out of and how many like layers, or making sure that these are things that are preventing those particles. It's kind of funny to say, because even speaking to somebody, you kind of, there is the possibility for, like micro droplets of virus to travel in the air. So kind of makes you think twice just on a daily basis when you're talking to people.
Yeah. It's insane. I think it's insane how fast this thing has been spreading. And I just wanted to go over the numbers in Navajo Nation. How many people were first infected, do they think, to like now? How many days ago was that?
So I was trying to pull up the number from day one, and I had all my notes up and ready, and then I restart my phone. Not a genius move. But I'll say March 11 is when Navajo Nation declared a public health state of emergency for Navajo Nation, and that was really, I feel like even at March 11, that was kind of slow. I mean, we were observing what was happening in Wuhan, China in December, but that still gave January, February, and half of March to take action or take precautions. Mm-hmm. So it's kind of like it's like a house on fire, and we're throwing just buckets of water after the house has already started to burn. So this is something that I feel like as a nation we could have been more prepared, and it's really upsetting, because knowing that each year, like, our CDC budget had been reduced, that there had been tariffs placed on medical equipment coming from China, and less companies were purchasing them, and now we're at a point where we're needing ventilators and we are struggling. So this has been frustrating, to take a look at as a whole, but we can't dwell on the problem. Mm-hmm. Right now is time for the solution, and part of that solution is keeping people at home, reducing the risk of transmission. And even if somebody claims, like, I feel fine, I'm okay, I'm good, I don't need to wear gloves, I don't need to wear a mask, I wash my hands good enough. This is the type of behavior that somebody that might be asymptomatic might be taking home and have 4 other people under the same roof. It just spreads. That's how it spreads. So we need to be more diligent and more mindful about our hygiene habits, and reducing the potentially contracting, this virus by making non-essential trips outside the house.
So this gets to my next question. There are some nations right now that are enforcing a lot of heavy restrictions on their people. So preventative measures. So non-nation members not being able to come in. There's also only being able to travel outside the nation if necessary. Some nations are instituting curfews. Some are doing social distancing, and they're encouraging their members not to go visit their family or friends, not having any wakes or funerals. These are nations that have right now have zero confirmed cases. Do you think that these nations and their leaders are being overly dramatic, or they're over? There's a complete overreaction, or do you think that this is necessary?
I don't think that this is overreacting. I do think this is 100% necessary. This was something that even within my own family, we had to make this decision about what to do regarding a funeral. And this funeral happened the same week as the Chichen Bato outbreak. And it was a very difficult decision to make, and we weren't really sure, what to do. And so, looking back in hindsight, I feel like we should have been cracking the whip a lot sooner. But to the tribes that don't have any cases, I'm proud of leadership for taking the initiative to keep people at home and to reduce the potential for an increased number. It's unnecessary to put people at risk, regardless of how stubborn they might be, assuming that this is just a small problem, it might go away. There are even conspiracy theorists that are stating that this is a hoax. When you see the death count increase from this virus, you cannot deny that there is a problem. And by taking these precautions for, all of these tribal leaders are doing the right thing. Quarantine, brilliant. Curfews, great. I mean, now this puts an exclamation in people's heads. Hey, this is urgent. There is a reason we're not allowed to go out. And so I do wish that more people take that seriously. But for now, I know people are going bonkers in quarantine, but that's okay. This is a time to learn a new craft, perfect a new recipe, start baking, bead that pair of moccasins that you said you were going to do, but you never got around to. Whatever
Those
it might
snagging
be,
moccasins.
however you want to. Yes. Maybe get your patchwork skills on, make that snagging blanket, whatever. Just keep yourself inside.
Are you? So one of the things. So I was going to say this right now. If there's anybody that's watching this and has any questions, you totally just type them up. We'll answer them at the end. One of the questions I have is: Is the nation currently getting any help from the government?
Good question. So there was a COVID relief stimulus.
Your audio's cutting out.
And
Hold on, your audio's cutting out a little bit. Okay, try again.
Okay. So there was a Navajo Nation stimulus package. Excuse me, a U.S. Native Nation stimulus package that was proposed, and it was voted, and that is something that is available, that will be going into disbursement soon. So, but about that, before I chat too much about numbers, I really want to also put this out there that any of the stimulus funding or any of the checks that will be coming through, please, my Native people, keep in mind that next year this could be something that you're going to be seeing in your taxes. So spend it wisely. That's just, I'm not an accountant, but I am wise. Keep that in mind. Okay. But I'm going to grab you. So we're talking about dollar amounts. And I wonder, is Pete going to come back?
I have no idea. Hopefully.
I'm here, man.
Oh, we were waiting for you the whole time. All right. Is there anything you want to add to that? Let's go back.
Which one?
Let's go back to that other question I previously asked. Do you think with the restrictions they're placing on their people, do you think it's an overreaction?
No, I don't. I think it's an underreaction because the more, you were talking about how there's some nations who don't have any cases yet that are already doing this. That's good to keep it that way. We don't need any more cases on other in Native American reservations. I mean, I think, you know, we have to take this seriously, and sometimes Native people can be stubborn. We as people can be stubborn, and sometimes we have to be herded in that direction. And these leaders of ours, they understand that. So I know some people might be upset with this curfew, quarantine, social distancing, but we have to curb. We have to, we have to fight this as much as we can, because Sahara and I, we like to travel, and we adhere to these rules because we understand that in order to make this go away quicker, we have to distance ourselves, because this thing travels through people. It doesn't travel mysteriously.
Mm-hmm.
It transmits through people. There's that saying on Facebook where it says, this thing will stop moving if people stop moving.
Yeah, that's good.
Yeah.
I get to see that. That's amazing.
Hey,
That's going.
that looks familiar.
That's gonna be my next Facebook status update. Actually, once this is done.
I can see myself there.
I think like for me, it's so there's things that bother me. One of the things that bothers me is people who are saying like we have our medicines, we're going to be okay, and I agree with that to a certain extent, because there was influenzas, there was diseases that came through that completely wiped us out, and I think the death rate isn't as high as some of those other past diseases, but like if you're gonna put yourself at risk and then you're just gonna go home and drink some tea, and I don't know why you wouldn't just stay home and avoid all of that altogether.
Yes.
And you could still drink tea. Like that's a thing. You could still have your root tea and not have put yourself at risk. And I think about like the pre-existing health conditions, that people have: diabetes, obesity, people with their like liver problems, and these things get you that much closer to having a serious bout when you catch COVID. And like I don't know what is the like the general overall health down in Navajo Nation.
It ain't good. But the high risk factors are there. The diabetes on the reservation is huge. It's a huge problem in Navajo reservation, especially heart disease as well, because of the high blood pressure, cholesterol, and that is what we're trying to pound home. We're trying to tell people, if you already have problems with your respiratory system, this thing is just gonna eat you alive, man. Please stay home. Let's just do it that way. And we're not trying to make anybody's life hard. There's some positive. This weekend I delivered some food and supplies to a family who's positive coronavirus, and seeing the look on their faces through the door, just the way they are, it's sad, man. It's sad. And it's just hard, man. I'm just hard. Like, how can I convince you to stay home? How can I convince you that this is real? And that's the battle I think we are fighting here on the Navajo Res, and the program, the Utah Navajo Health System we work for. We are trying our best to keep hammering that home. That this is serious. This is real.
Are you? The other question I had was: are you getting help? Is your nation getting help from the government?
I know the U.S. National Guard came last week onto the reservation to help disperse some supplies.
I think you broke the internet.
So the National Guard came onto the reservation, and they started patient transport, and with food and supplies, taking it to different little towns in the Navajo Res. So in that sense, the U.S. government is helping.
Yeah.
Because the Navajo Nation does not have the infrastructure to test everybody and to house all these people that are positive, and we have to curb that. Because if it goes beyond, we don't even want that. If it goes beyond 1,000 or something, that's just gonna, that's gonna be bad. that's just, I mean, I don't know how else to put it, but 1,000 positive cases on the reservation where the infrastructure can barely handle testing 15 people at a time, maybe 15, 20, 30 people at a time. It's that's the reality though. It's the reality, and we have to deal in realities for people to really understand this.
What are your biggest challenges? You talked about like making this real for people. What are some of your biggest challenges along with that?
So I think some of my biggest challenges with the program that I work for is that there's a lot of the biggest problem is getting the essentials that people need, because everybody writes down a list of what they need, and it's always toilet tissue and bleach. The stuff that that you wouldn't think would be such a huge high in demand material until now, but is trying to get people the things they need so they can stay disinfected enough to not have this virus around them. That's the hardest part of this. Is I mean, I already said the biggest challenge is translating this, how important and how deadly this virus is. But the second part is getting these essentials. And the health system we work for here in a Utah reservation, they really, when I approached them to put this program together and let me try to help the people, they were all for it. They threw all the resources they had at the time at me, a certain amount of resources. Then the people from other programs, other health departments started coming together and really try to tackle this, so people don't have to go to town, people don't have to starve, people can just stay home and wait it out. We and the supply is also is one of the biggest challenges, gathering all the supplies we need for people to feel like they're it's enough for them to just to wait it out till this is done.
Sahar, do you have anything to add? Is she there?
I have no idea.
I don't know if she's still there.
We are in a spotty reception area.
Yeah, that's true. She was telling me about that. Uh, how are you dealing with this all right now? Like, how is your own personal mental health?
Well, that's one thing that a lot of the old folks also tell me too when I go deliver stuff to them, is that you've got to take care of yourself.
Mm-hmm.
Self-care, because a lot of my coworkers here, a lot of people who I work with, they also say the same thing. You gotta take care of yourself, Pete. You can't. You gotta give yourself a break. You gotta distribute. You can't do everything. You got to spread it across everybody, and really, really ask for help. And that's what they've been very encouraging with doing that. And I've been doing that. These people I work with have been stepping into the plate and making everything so much easier. And this is a good example of the program that we have here, is how people all come together and they really support each other, and that's what we need right now. That type of support to really, because this just seeing the numbers rise and double every week, that can be draining on your health, because you're like Sahar said about the burning house, because just throwing buckets of water in a house that's already consumed in flames, and it can really feel overwhelming and feel like you're not making a difference. But it's good to just kind of step back, because sometimes I'll just step back and I'll watch like a funny movie, or just something that has nothing to do with the virus.
Yeah.
Like I play music, so I'll just sit and play my guitar for a bit, or just really step away from it.
Yeah.
So just be away from it for a couple hours helps me. Just kind of just let me think on this, let me do my thing, and just let me recenter myself. And that's very important for all the people out there that are doing charity work, man. Donations, helping each other. You got to be able to give yourself a break. You got to look at yourself and really, the truth is you can't help everybody. You can try, but you can't help everybody. But our mission is to help as many people as we can. And then we all work here to make sure we can make that happen. Myself, Sahar, Colinia, Byron, all these people that come and help this program that they let me put together, and really really put it together. Like last night, dude, I watched Son-in-Law.
With Pauly Shore.
Yeah, I'm like, it's like the stupidest movie ever,
Mm-hmm.
and I just needed that laugh, you know. I needed that, and going out to these people and seeing them, you know, they'll joke around you. Natives are very humorous people. Native
Yeah.
Americans are so funny, and we're known for our humor. And when we go out and talk to people, it's like how do I greet you? I can't shake your hand. You know, I can't give you a hug. And you know that draining part, that interpersonal connection, is not there anymore. And it feels like you didn't welcome somebody fully. You know what I mean?
Yeah.
You didn't welcome them fully like you were taught to traditionally.
Yeah.
It's that part is gone. You've only gone 90%. You didn't go 100 on that in that area, so that it feels distancing, and people realize that, you know, people are not meant to be alone. It's a good example right now. This social distancing, you know, is that people are told to stay home. You know, don't go anywhere, don't meet anybody, but we can't. You know, that there's that social interaction that people need, and you know, now it's really being tested.
I think for myself, it's kind of like we're jumping in a time machine, and we are those people now that are facing that epidemic. Like we've always been different than white people. You know, they've kind of just left us. They've always just left us. Never really gave a
Yeah.
shit about us. As we face these pandemics, these epidemics wipe us out. I really feel like there's some old jobs and roles that we have to step into to help provide, protect, inform our people. But saying that, okay, there's some nations right
Yeah.
now that have zero infections. What message would you give these nations? Like, for instance, if you could go back in time, what would the advice be to your people? Like, what would you be telling them before the outbreak happened? What would you be saying?
Wash your hands. Wash your hands, sanitize, and you know, be careful who you're around. It really is. You know, how do you prepare for something like this? How do you prepare for an enemy you can't see?
Mm-hmm.
How do you prepare for an enemy that you can't see and that can get to you in all sorts of ways? I don't know, man. It'd be like telling somebody. It'd be almost like telling somebody there's a natural disaster coming and everybody thinks you're crazy.
Hmm.
And what do? You know? But you know, we've always had that. There's this thing out. There's this interview I listened to on NPR the other day where it was a Navajo man they're interviewing. He says, "We are told to wash your hands for 20 seconds." He's like, "We don't have running water in my house, so every time I wash my hands, I gotta wash for 20 seconds." And that water that we use has to be fresh. They say, tell us to use fresh water. That means we have to pour out water every time we wash our hands for 20 seconds. There's no way we're going to do that because we can't keep going and get water every time. Like, how do you give advice on that?
I don't know, man.
Yeah, that's the reality. Like, how do
Oh,
we
you know how you
figure
do
that
it?
out?
You know how you do it? You stay the fuck home. You socially isolate. You don't go out of your community unless you absolutely positively have to, and do your best to prevent it. I think that's the only thing we can do on some of our nations. Just do our fucking best to prevent this shit from coming.
Yes, just stay home, man. We'll get through it. Just stay home. You know, don't leave unless you really have to. And if you have a program or a chapter house or some sort of there's an organization every Indian reservation has some sort of organization within their reservation government.
Mm-hmm.
This is the time for that organization and that government to step up and truly take care of its people. And that's a whole nother issue on its own.
Yeah.
Yeah, but that's the ideal, right? That's the ideal thing that they should be doing.
Okay.
And,
just to like keep moving along. Let's say the initial days. So You had that first preliminary outbreak.
Yeah.
What have you learned that you would want to apply immediately if a nation has they have an outbreak? They have like 5 or 6 confirmed cases. What's something that you immediately want to put into focus for people?
Quarantine those people. Straight away. Don't let them out of your sight. Don't let them go home unsupervised. Follow them and make sure they don't interact with anybody else.
So even just like talking to somebody, that's enough to get them sick. That's enough to make somebody else sick.
Yes.
Shaking their hands, sneezing.
Shaking their hands, talking to them, sneezing, being in the same room. You know, that's how bad it is, and it's that's one thing I would say is that the thing about this is quarantine those people and follow that line of who they talk to, where it came from, and you got to contain it. You got to contain it as much as you can within that area it started from. Even if that means quarantining off a little town or a section of that town, for the, because the more it spreads, the more it hurts, man.
What's the biggest lesson that once this is done, what's the biggest lesson you're going to pull from this?
That the people who really do matter, the people who really wouldn't say matter, but the people who really should be essential will be highlighting. People will know that which people really, really are important to this country's infrastructure. Wouldn't say matter, but the people should be essential.
Sahar, your audio is kicking up. Do you have some headphones?
Which
My back?
Yeah, you're back.
People really are important to this country's infrastructure. Listen to myself. Yeah. That's one lesson I think we're all going to learn is who's, what type of worker or what profession really is important. And who should be taken care of? The teachers, the doctors, medical workers, construction workers, people, the plumbers who are still working, It's just a lot of, those people who are still the police officers, that are, the firefighters, EMS, these people who are working every day, to make sure our country's still running. To those who are working every day during this time where there's a lot of people that are laid off or told to stay home, those people that are working still are the ones that are vital to this country's infrastructure. And those are the people who are important in making our country, to keep our country keep going. And, we got to remember, after this is over, we got to remember those people. We got to remember those people.
We should have a feast for them.
Yes.
We should, the fucking next gathering of nations should be dedicated to all the first responders and essential workers and fucking grocery store people. And the Asian people. And the Asian people that run our gas stations on our res.
Yeah.
Shit, we lost Sahar again.
Yeah, you see, it's not celebrities that are important. It's not the athletes that are getting millions of dollars. They're not the ones who are not important to the country. It's the people who, are saving lives right now. The grocery store worker, he or she is saving lives right now. That's a reality check I think a lot of us needed.
Yeah, it's a wake-up call.
Yeah.
What would you, so someone who's watching this right now, what's something they can do to help themselves and help their people?
Stay home, man. Stay home. Stay home. And if you want to help people, encourage others to stay home. And, wear face masks. Wear face masks as much as every time you go out. The best advice I can give people, I've been saying right now, is think of it this way, that any person you interact with has that virus.
Mm-hmm.
If you think about it that way, it'll make you, prepare, make you really think, because it is true, man. You don't know. Your neighbor could have it, your buddy might have it. Just if you think in that sense, like every person has this virus. I mean, to think about it, I might have it, Sahar might have it. We don't know it.
Yeah.
It's just you might have it. We don't know. So if we think like that, we better take care of ourselves and one another. That's, I guess, is my advice.
All right. Now my final question for you. Okay.
Yeah.
When this is all said and done, and we are on that other side of the curve, it's gone back down to zero. What is one thing you're looking forward to?
Drinking coffee in a coffee house and just reading a book, man. And sushi. I love sushi. So
some sushi.
Oh yeah.
Well, if you ever come to Alberta, Canada, I'll take you for fucking sushi.
Oh, I love sushi, bro, man. That's what I miss. I love sushi. I just love sushi. There's things I love, like live music. I love listening to live music. And everything I love to do is just like everybody else's passion is gone now. So that's the first thing I'll do when I'm done is get me some sashimi or nigiri.
We live in some crazy times, man. But there's a couple questions and some comments people had written up, so I just want to read them. Curtis has said a couple things. He doesn't have faith in the federal government will actually provide help to the Indian country. He doesn't think that we'll actually get authentically what we really need. They might do some kind of like, we gave the Indians X amount, but he doesn't believe it's enough. And I don't believe that we'll ever really get enough from the government to really sustain ourselves. Do you share those sentiments? And Sahar, you're back. Are you back, Sahar? Can you hear me? I can't hear you if you're saying anything.
So Sahar, you're back. I'm back, but it's I'm getting two software microphones.
Oh, okay, so mute it then.
I can't hear you saying it.
Pete, are you still there?
Yeah.
Oh my God, you gotta mute your thing, Sahar.
Oh, okay, so mute it then.
Oh, that's horrible. At least you're not frozen. Your face isn't frozen online anymore. I can see you moving. You can nod yes or no. Okay, so
blink twice for help.
Yeah, so I personally don't think we're gonna get the help we need from the government. I said this before when I was talking to Leonard Monkman. I think it was in Manitoba. Some of the chiefs had requested some medical help for SARS when that hit. And it was a conservative government. The conservative government just sent body bags instead of help. I think that we're left to our own devices in this. I don't expect them to do anything meaningful. What are your thoughts on that? Do you think they are going to try to help us or not?
I think, what does history tell us? And in the same sense, history should have taught us that we should rely on ourselves.
Yeah.
So we should have known that something like this could happen, and we should be prepared a little bit better. And we can't keep blaming somebody else. What does that saying go? You hit me once in the eyes, shame on you. Hit me twice, shame on me.
Yeah.
Hit me a third time, shame on both of us. We have to. I think Indian reservations, as a whole, need to start investing in themselves.
Yeah.
And we need to be able, if there's any Indian reservation, which I always say, if they say they're a sovereign nation, if they're truly a sovereign nation, then when the economic crash went down in the U.S., then that shouldn't have affected any of these sovereign Indian nations. So we've got to, if we got to stop saying stuff if we don't really know what it means. You know, we can't say we're sovereign yet ask for help.
Yeah.
You get what I'm saying?
Oh yeah.
Yeah.
What I learned from my my Mohawk friends in Akwesasne was that if you can't feed yourself, then you're not sovereign.
Yeah.
Like if you can't,
that's a good way to put
you
it.
can't feed yourself, you can't feed the community, then don't think you can talk about sovereignty. It's just the basics of living.
So we should. We should be able. I mean, history has taught us that through these type of pandemics, epidemics, or any type of national emergency, or anything that where the government was supposed to help us, they've never helped us. So we should have learned by now that they're never going to be there for us. So we should have built an infrastructure within our own Indian governance to be able to stand on our own feet.
All right.
And
so. Is there anything you'd like to end us off with? Any last messages you'd like to give to people before we head out?
Yes. My message before I sign off is I believe in Indian people as a whole. That we are smart. We are crafty. We are artistic. We can find our way through anything. And in the end, we will be smiling because humor is a big part of who we are. And laughter is medicine. We got to remember that we're all one people. Regardless of our differences, our history is that this virus, I should say, not disease, this virus, it's and knows no color, knows no gender, knows no race, and we have to help each other through this. And sometimes helping each other is listening and sitting still and letting the earth repair itself. And in that way, we let the earth repair itself is how we let our bodies repair itself as well. Our society, our minds will repair ourselves. And there's a good right now is a good example of how our mentality, our mindset is not as it once was, because we can't handle sitting still. We can't handle staying in one place. And right now is a good time to learn them songs that everybody wanted to learn. And what Sahara was saying, good time to learn to beat. Good time to learn your own language, man. Start learning language. That's without our language, we're nothing. That's for all Indian tribes. And that's all I got to say. Love everybody, and hope to see you in Canada soon.
Anytime you want to come up, like I said, sushi's on me.
Dude, I got my passport a week before this quarantine. I was like, man, I'm ready to travel the world. I got my passport. Nope. Yeah.
Well, fuck. When this is all done, you just come up, or I'll come down. We'll visit.
Yeah, man, that'd be cool.
Let's hold on, Sahar. Can you?
Okay.
Oh, it's working.
Is it going to go like bouncing back and forth? I don't know. I put the Facebook speaker on mute and everything else. So
yeah, you're good.
Great. So when this is all over, I need to travel. That's like my thing. But I think I'm gonna just hang out for a little bit and make sure that globally we're safe again. And then I need to explore.
Nice. You're gonna come and visit your husband and his people on their lands?
Yeah, they're so he's from the Calgary, Alberta area.
Yeah.
Wait. Yeah?
Yeah.
Yes.
They're right next to Calgary.
I don't know, I just like a brain freeze for a moment. But I'm so in love with Banff. Oh my gosh, it's gorgeous. I mean, I don't know though, because I was like, which do I think is more aesthetically like stunning? Like I'm breathless when I see Banff, right? And like those gorgeous blue water. But then I'm equally like breathless when I see the Monument Valley and like that red rock and so I like things to eat.
All right. Well, on that note, I think that I believe that we're all going to get through this, and we might be self-isolating, but we're still connected.
Here's an update.
An update?
My grandmother is in Iran, and because I mentioned half Persian, half Navajo, so she is in a hospital in Tehran, and she is COVID-19 positive. She's also diabetic, and this has been a really hard time for our family to kind of plan and wrap our head around what's going on. But I'm relieved she's no longer needs the respirator, and she goes home on tomorrow, Monday. So
she's over the hump.
Yeah, and so that gives me a lot of hope, and I was really worried, and we can, as long as we're taking care of ourselves and we take care of our community by being selfish and staying home. It's not even being selfish; it's literally taking care of other people. We can get through this, and we can start going out to restaurants again. We can start going out for Korean barbecue, coffee shop, sushi for Pete, but just hang in there, hunker down, get your favorite books going. I'm gonna start reading Tommy Orange. There.
I'm like halfway through that.
No spoiler alerts, please. We should have a book club afterward. Everyone go read it, and then we'll all come back. We'll join you on your show, and we'll have a book club. We'll have a discussion.
I'm down. All right. Well, on that note, yeah, like I said, we're in isolation, but we're all together. We're all connected, and we're gonna get through this.
Right on.
So I'll see you guys soon, and then we'll check up with you guys in hopefully a week. Praying that people in your nation just flatten the curve.
That's me. That's me. If you didn't know.
I was gonna draw some animation mouth, like a stop motion animation, like you talk when you're talking, but I didn't. Sorry, Pete.
For the next one, we'll do that. All right. So for now, good night. Take care. Much love.
Good night.